All right, so welcome back to another episode of PT Meal Physical Therapy Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of physical therapy profession and practice. So today we are still going to talk about physical therapy, but not on humans. Physical therapy. We're going to talk about physical therapy on horses. So equine physical therapy. So I'm sure you all are very excited, as I am, with this conversation. So without further ado, to join us in this podcast today is Dr. Barbara Parks, a physical therapist based in Nashville. She is a certified equine rehabilitation practitioner and a certified therapeutic riding instructor, providing physical therapy services to horses and their riders. So I'm sure you all are curious with her story. So welcome to the podcast, Barbara.
Uh-oh, did I lose you?
I kinda you froze a little bit.
Dang. Oh, okay, well, I'm here now. Thanks for having me.
I'm glad to have you here. So yeah, so we're gonna talk about equine physical therapy, horse physical therapy. Uh, so to start with, so what what made you decide to go into equine physical therapy?
Okay, that's a really good question.
Mm-hmm.
When I went to PT school, I had no idea that equine physical therapy was even, I had never heard of it.
Mm-hmm.
Originally got me going to PT school was hippotherapy,
Mm-hmm.
which is working with like children or adults, but using the horse as a treatment tool in clients. So that's what got me going to PT school. And then when I was in school, we had a guest lecture one day. And so she's the one that introduced me to the idea of doing PT on the actual horses themselves. So
Gotcha.
child and adult. So once I knew I had to go for it.
So
Yes.
yeah, that's nice. So you got inspired by a lecturer, uh, and
Yes.
you found that out, right? So how do you like being a equine physical therapist right now?
I think it's wonderful.
Mm-hmm.
It's tough because it's a really unique, small kind of niche field that
Mm-hmm.
a lot of people don't know about. So even in the horse industry, people don't know that I exist or that I'm an option for them.
Uh-huh.
Chiropractors are really big. Massage therapists are really popular, but physical therapy is kind of new, especially in the States. Over
Mm-hmm.
in Europe, it's a little bit bigger. So that's probably my biggest challenge, is educating folks about what I can do as a physical therapist, and that I even exist and am an option.
Mm-hmm.
So that's hard. And that's why I try to do all the social media stuff and YouTube to kind of get that out there. But the actual treating of horses is so important, and it's such an underserved kind of community for physical therapy, because our horses, more so than any other pet that you might have,
Mm-hmm.
are athletes. We're asking them to do some crazy stuff. We're riding them. They were not built to be ridden
Right.
necessarily. So they end up with a lot of, aches and pains and compensatory movement patterns and stuff, just like human athletes do.
Mm-hmm.
So it's really awesome to be able to help them with that.
Right. They have to perform at their top level.
Absolutely.
Mm-hmm.
Yep.
So how does one get credentialed or be an equine physical therapist here in the States?
So here you have to first go through your human physical therapy doctorate program,
Mm-hmm.
just like any other physical therapist. And then I believe there are two different certification programs, but the one I did is the CERP, or Certified Equine Rehabilitation Practitioner one. And that is at University of Tennessee in Knoxville, which again is another reason why I jumped on doing this, because it just worked out so perfectly with me being in Nashville that I could go to Knoxville for that certification program really easily. Now,
Mm-hmm.
when I did that program, there were maybe 20 of us in that class, maybe 25. And it was
Wow.
people from all over the world. So it was really really cool. It's a really small niche in our profession still. Um, but yep, you do that certification program, which is an online portion and then an in-portion lab. You go and stay at the university for a week, and we did a full cadaver dissection just like we did in PT school, but on a horse, and all the
Wow.
practical hands-on stuff. Yeah, it was
Hmm.
really, really cool. And then we do case studies at the end and take a test and then get certified there.
Hmm. So do you have to actually like or know how to ride a horse to be an
You
equine
you
physical
probably
therapist?
you probably should.
Uh-huh.
You should at least like them for sure.
Uh-huh.
No, but I think a really found like a really solid knowledge of horses is important if you were
Mhm.
going to do this, because horses can't talk to us, right?
Right,
So
right.
knowing how to read their body language and know what they should look like or how they should act versus, maybe what they're showing you on your evaluation is important, because owners might tell you one thing, but you have
Mm-hmm.
to be able to make your own assessment based on how the horse is presenting. And they have such subtle body language. If you don't really know what you're looking for, it's easy to miss things.
Mm-hmm.
And as prey animals, they're really stoic by nature. They're not likely to show you that they're in a lot of pain until it's pretty significant. So
Mm-hmm.
again, you're looking for really subtle changes most of the time.
Wow, assessment must be hard there. So go going back to the credentials, are there
Sure.
uh are there any specific states that only allow, physical therapists to
Ooh.
practice equine physical therapy?
So this is a good question.
Mhm.
If you're going to call it physical therapy, you have to be a physical therapist, right?
Right.
Anywhere
Mm-hmm.
you are,
Mm-hmm.
supposedly, anyways. But it's really tricky right now because certain states' veterinary practice acts
Mm-hmm.
are worded such that only veterinarians can work on horses.
Mm.
So, as a physical therapist, I cannot even touch a horse legally,
Mm-hmm.
in certain states,
Uh-huh. Okay.
which is kind of wild.
Right.
Because
Mm-hmm.
we have a doctorate degree, we have certification,
Mm-hmm.
but that's with it being so new. I understand, the caution, from the
Mm-hmm.
veterinary community. They want to be sure that they're only letting qualified people touch horses, but
Right.
it does make it kind of confusing and hard to grow, and hard for people who maybe if they live in a state where the Vet Practice Act is kind of restrictive and
Mm-hmm.
they want to go into this, they can't. So that's
Mm-hmm.
kind of hard right now, but hopefully that will start changing here
Right. Once
too.
they, the practice gets
Hmm.
more popularity, gains more
Absolutely.
ground, yeah,
Yeah.
hopefully it gets recognized by the vet community.
Right. Yeah, that's the hope. That's the hope.
Hmm. Right. So you introduced us like to the assessment and treatment. So what are the
Sure.
techniques or treatment interventions that you provide
Yeah.
to horses? Are they like much similar to like humans?
I think you would think it's extremely similar to humans. It
Uh-huh.
looks different because horses are humongous.
Uh-huh. Right.
And so our technique has to be, you have to modify things, and there are certain things that we can't quite do that we could do with a human.
Mm-hmm.
But it's very much the same. So I do a mix of manual therapy, and then kind of like corrective exercises, and then what you might even consider like neuro re-ed kind of balance and proprioception exercises. I mean, anything that you can do for a human being, you can
Uh-huh.
adapt and find a way to treat a horse in a very similar way because they have very similar problems. So
Uh-huh.
it's a lot of creativity trying to adapt sometimes, but it works. It really works.
Right, right. So when you're talking about corrective exercise, you re-ed. How do you make
Hmm.
horses do what you want them to do if you can't instruct
Yeah,
them? How creative would you
right.
be?
Yeah, so that's again where having some background like horse knowledge is pretty
Mm-hmm.
important. Having a general understanding of training and how to motivate a horse to do something is important. But think about like I kind of relate it to pediatrics a lot.
Mm-hmm.
So sometimes you might have a kid who is nonverbal, they can't communicate easily with you, and you can't communicate easily with them. And so you have to find a creative way to get them motivated and to accomplish the task. So it's very similar, I think, with horses, because we don't speak the same language, but
Right.
we can kind of find a way to communicate that's creative and using things that are motivating to a horse, like food's always
Mm-hmm.
motivating to a horse. So you can use things like that to kind of get them to cooperate. And horses are really generally very cooperative and want to please. So
Uh-huh.
if you're patient with them and have kind of the training skill set, at least a little bit there, you can usually figure a way for most things. Now there are times that I have to say, oh, that didn't work like I thought it was. Let's try
Oh,
something
okay.
different, of course. But yeah, it's I think it's pretty similar to working with kids a lot of the time.
Is it the same like with treating humans that you have to build rapport with a horse
Oh, for
before,
sure.
you know? Oh, okay.
Yeah. There's definitely a layer of trust involved, right, in everything. And some horses more so than others, right? They all have different histories. Some of them may have come from a really, traumatic background of
Mm-hmm.
something, an accident that was traumatic or an abuse case or something, really awful. Or they may have had a really, easy life where they had one loving owner for all their life and it's been pretty smooth. So those two horses would take, a different amount of warming up time to trust me coming in. Um, but similar to people, right? We all
Mm-hmm.
have kind of different backgrounds, and some patients warm right up to you and some you
Right.
really have to chip away at and convince them slowly over time that we really do have your best interest at heart. We're here to help. So yeah, moral of the story is it's really similar.
Is
It
it
really
true that
is.
horses would feel if you're afraid of them?
Oh, for sure.
Oh, really?
Yeah. Yeah.
How do you take a horse to an assessment? Do you have that horse move, or do you just ask their owners or riders, or?
Sure.
Mm-hmm.
So it depends on what I'm called there to, what the issue is, of
Mm-hmm.
course. But I usually like to watch the horse move first, just like
Mm-hmm.
I would with a rider assessment or something.
Mm-hmm.
You want to see what kind of patterns can I pick out right off the bat? Is anything jumping out at me, or does the horse look pretty normal?
Mm-hmm.
And we're gonna have to kind of feel around and poke and prod. But so that's what I start with, a movement assessment. I try to do, you know, all the different gaits the horse has. So, like if you were going to watch someone walk and run, you'd watch the
Right.
horse walk, trot, and canter. So, all that first. And
Mm-hmm.
then if they're a riding horse, I really like to include watching them be ridden because you
Mm-hmm.
can pick a lot up there. The rider impacts the horse sometimes in ways they
Mm-hmm.
don't realize.
Mm-hmm.
So I might be called out because they think the horse has an issue and watch them ride, and you're like, oh, that was a rider error that's causing this
Oh,
problem.
okay.
So sometimes you have to tease that apart too.
Mm-hmm.
But that movement assessment is first, and then I move into kind of just a head to toe palpation kind of assessment.
Mm-hmm.
So with my human patients, they can kind of point me to where the problem is. Usually a horse can't verbally do that anyways. So
Mm-hmm.
I rely pretty heavily on palpation skills and observational skills of the horse's body language to tell me, have I hit something that hurts, or do I feel something restricted? Am I feeling a joint that's, feeling restricted with motion? So that kind of stuff. The palpation skills are really important. So I move through all that and just kind of see what I find. And then from there, if there's something I need to treat, if I found a restriction that needs further treating, I'll hang out
Mm-hmm.
there and work on that. Or if it's more of a we need to move into some corrective exercises, we go that direction.
Mm-hmm. And you mentioned earlier that you also do manual therapy on horses, like on their extremities
Yes.
and stuff.
Oh yeah.
They're
Yeah.
big.
So they're big. Yeah. So that's where adapting your human techniques really comes into play, and finding ways to improve your leverage.
Uh-huh.
Because I'm really small. I'm 5 foot. I do not have size on my side. Or if I'm working on, can use my body weight. And you definitely have to be careful, with your body and with
Mm-hmm.
the horse you choose to do something like this on, because um, if a horse isn't going to let you take their leg and
Uh-huh.
be relaxed with you holding their leg, I'm probably not going to try a manual therapy technique on the leg at that time, right?
Mm-hmm.
Because that puts me in danger of getting hurt.
Okay.
So you have to be smart about when you do what, but you can definitely do uh, joint mobilizations and all kinds of stuff just like you would on a person.
Wow. Wow. Just imagining pulling on a horse's leg. Wow.
It's heavy. Yeah.
So, what are
Yes.
you mentioned earlier that biomechanics of the rider can
Right.
sometimes cause some problems with horses, and what other reasons or conditions do you see a horse being referred to you?
Probably the most common thing that I see is back pain. That
Mm,
is a big one. I kind of touched on this earlier. Horses were not created, knowing that we were going to hop on their backs and try to
mm,
ride them.
mm,
So it's when you're riding a horse, you do have to be careful, about how they're moving.
mm,
If they're in a lot of thoracic and lumbar extension, you can just think about how those spinous processes can impinge and cause a lot of back pain. A
right.
horse's spinous processes are really long, if you
Mm,
look at a horse skeleton compared to ours. So less lumbar extension ends up impinging those spinous processes than you might think, and that happens a lot. You can
mm,
see it on radiographs. But so you have to be careful about how you ride the horse. You have to be careful about how the saddle fits, because
mm.
not all saddles are made the same, and every horse's back is a little bit different in shape. So
Oh,
if
I
a
didn't know
saddle
that.
is pinching, yeah, if a saddle is pinching in a spot, or if it's rocking back and forth as you're going along, or if the padding isn't even and it creates a pressure point, then
Mm,
that can cause a lot of issues too. So being knowledgeable about the equipment and how to check for common issues with equipment is really important
mm,
in this job too, because it's pretty common to find
mm,
issues there. um, and so back pain, yeah, is a big
mm.
one. And then I also get a lot of people who just are like, my horse is not acting right, and they don't know
Mm,
why, and they can't quite pinpoint something. That's really common too. Now horses get injured, they have tendon injuries, kind of like a sprained ankle, or you know
mm.
surgeries, or more kind of traumatic things too. But I see a lot of chronic, something's just not quite right and I
Mhm,
need help. That's usually when someone finds me, anyways,
mhm.
because they're looking for something outside of what they would normally do. And so I see a lot of horses that have been off for a long time, and we just don't know what's wrong. So
Ah,
that makes it interesting.
uh-huh. And your job is to
Hmm.
find out what's wrong, and hopefully the horse can
Right.
come back to performing.
Sure.
Uh-huh.
Yeah. Yeah.
Okay.
Yeah. Find the root of the cause, really. So
Mm-hmm.
lots of detective work sometimes.
Right. So you mentioned you talk about the back pain, and sometimes
Hmm.
you get referrals that would say that I just don't know what's wrong with my horse. I feel there's something wrong. With back pain, is this the same thing? the the
Yeah.
the rider or the owner would notice something different about their horses.
Sure.
Oh.
Yeah, that's a lot of times they'll notice, like, say the horse is barrel racing or something.
Mhm.
And the owner might be like, okay, well, usually when we take this turn, it's smooth and fluid and easy. But
Mhm.
yesterday I was riding and he was kind of slowing down, or stopping
Oh,
short, or I just didn't feel like he was 100%.
right.
Or the horse might start biting at you,
Mhm.
or pinning its ears, or getting upset when you go to put the saddle on, or
Mhm.
any kind of change in behavior.
Mhm.
And that's what I tell people to look out for kind of to know that there's something maybe painful going on with the horse, is any kind of change in behavior from one day to the next, or change in performance, with whatever you're asking them to do.
Mhm.
Because I touched on this a little bit before too, but how subtle the signs sometimes are, because
Right.
they will hide pain as much as they possibly can, because out in the wild, if they show weakness, they're going to be the first one to get
Ah.
get
Uh-huh.
gotten. So that's kind of a protective mechanism they've evolved with
Mhm.
forever. So those little changes in behavior, um, or ability to perform, can be a sign that something, significant's going on physically or pain related.
Mhm. Oh, that's interesting.
Hmm.
Yeah, you really have to, as you've mentioned, the a key to an assessment would be your observation. Really.
Yep.
Mhm.
Yep.
Wow. You are also um a certified therapeutic riding instructor. Is this a certification for treating the riders specifically?
So it's not exactly physical therapy related, but
Uh-huh.
kind of is. So before I became a physical therapist, I got that
Mm-hmm.
certified therapeutic riding instructor title.
Mm-hmm.
So that is more like to teach children with disabilities how to ride.
Oh, the
For
hippotherapy.
adults too, but yeah. So hippotherapy, I know it's like all these different horse related things, but so the hippotherapy is physical therapy specific. It's physical
Mm-hmm.
therapy where the human is riding the horse,
Mm-hmm.
and then therapeutic riding, or we're trying to get that changed to be called adaptive riding, because it's a little confusing, because
Mm-hmm.
it's not physical therapy, right?
Right.
It's more teaching a riding lesson to a
Mm-hmm.
kid,
Right.
or an adult with a disability.
Yeah.
So
I read some journal about that it's
similar but
relaxing
different.
pediatrics, right?
Mm-hmm. Yeah, yeah.
Mm-hmm. Okay. So you you treat the horses and you also treat the riders. So what
Mm-hmm.
are the, you know, for riders, horse riders, what are their like common complaints? Well, I would
Okay.
imagine back pain, but
Yeah, right. It's like with every human being, back
uh-huh.
pain, like scapular pain. No, I think most riders have the same issues that you see people in your ortho clinic
Mm-hmm.
coming in with. We sit all day at
Mm-hmm.
work, and then we go try to do something athletic, and
Mm-hmm.
hip pain, back pain, um, difficulty, with posture. With
Mm-hmm.
When you're riding a horse, your posture and your core strength is really important.
Right.
So a lot of us, when we sit all day and are like rounded, forward head, our shoulders are rounded posture, and then you try to sit upright on a horse, and your
Uh-huh.
riding instructor is barking at you to get your shoulders back, and if you're having trouble with something like that,
Mm-hmm.
that's where I think I can be really helpful to
Mm-hmm.
kind of retrain those motor patterns. But also, if you're having pain, of course, calming that down.
Mm-hmm.
But riding, you're sitting astride, so you have to have some amount of hip mobility to be able to do that.
Mm-hmm.
So I find a lot of folks have trouble getting enough hip mobility to do what they want to do, or ankle mobility too, because when you're riding, you want to have your heel lower than your toe. So you have to be in a good
Oh.
bit of dorsiflexion to achieve that. And a lot of people have trouble with that. That's pretty
Mm-hmm.
common.
Right.
Yeah.
And I imagine it's different from a race, I don't know what to call it, when the person riding is in a race or in a show, right?
Sure. Yeah. Yep. So different, styles of riding require different riding posture or different, skill set
Mm-hmm.
from the rider. So yeah, it can vary a bit, but I most people have pretty similar complaints, and it tends to stem from, I think, our sedentary lifestyle
Mm-hmm.
and a lack of good core stability and control. Those are the biggies.
So you can also advise the riders on exercises that they can, do to strengthen their body to be more adapted to riding their horses.
Absolutely,
Mm-hmm.
absolutely. And
Mm-hmm.
I find a lot of my riders get frustrated because they feel like maybe equestrian sports aren't taken as seriously
Mm-hmm.
as other athletics.
Mm-hmm.
So they may get kind of brushed off by their doctor for
Mm-hmm.
complaints or
Mm-hmm.
brushed off by other providers. So that's a good thing about me being really
Mm-hmm.
familiar with equestrian sports.
Mm-hmm.
I take them very seriously because it really is, I mean, requires a lot of strength and balance, and reaction time has to be spot on. So it,
Right.
it they can benefit a lot from some little performance enhancement kind of things.
Mm-hmm.
Make a big
Wow.
difference.
When you talk about equestrian sports, it
Mm-hmm.
encompass all sports that involve a horse.
Yes.
Mm-hmm.
Yeah. Yeah. Yeah.
So like
Or
polo
riding and
racing,
yeah,
those
jumping.
jumping. Oh.
Yeah. Yeah. All different kinds of racing, and
Mm-hmm.
there's all different kinds of breed specific shows, and
Mm-hmm.
um, kind of like what you might think like cowboy kind of stuff,
All
roping
right.
cows and that kind of stuff.
Uh-huh.
There's all kinds of stuff. There's a very wide variety
Mm-hmm.
of things you could do.
And those horses that they use in their farms, like gathering up the animals and
Yeah.
stuff. Oh, it's
Yep.
yeah. There's a lot
Yep.
of ways that can address that. Not just like you're racing and stuff. I see. It's
Right.
interesting.
Yeah. Yeah.
Hmm. Do you also
Yeah.
like?
Especially when people
Sorry.
aren't real familiar. Oh, that's okay. I was just gonna say, especially when people aren't all that familiar with horses, that you think a lot about horse racing. That's
Hmm.
really high profile, or like Olympic sports. People sometimes know, but yeah, I think people forget about how many different things there are out there.
Right. Do you also work with the trainers of these horses on how they can improve, well, their training program and
Right.
prevent them from getting injured again?
Absolutely. So
Hmm.
that's a really important piece,
Hmm.
um, because, I can't tell the horse to go home and do these exercises, right? So
Right.
somebody has to be in charge of implementing the
Right.
plan that we put in place. So if there is just the owner involved, then it's a lot of owner education, about, how to change, if there's a change in riding style that we need to make, or if there's a change in lifestyle management we need to make. Um, a lot of people keep horses in stalls, which means they're kind of standing still for, I don't know, 12 to 24 hours a day sometimes.
Hmm.
And that can be really detrimental to healing from injuries or getting improving back pain. It's like putting a person on bed rest because they're in pain. So there are certainly times when we need to do that, but a lot of times I'm advising people to give their horses more time out of a stall so they're getting more movement and not being quite so sedentary.
Hmm.
So lifestyle changes have to be implemented by whoever's at the barn. And then
Hmm.
if there is a trainer involved, I have to get them to buy into what I'm encouraging too, because sometimes it runs counter to what the trainer might be doing already, or it might just require some changes. So you have to it's a team approach for
Mm-hmm.
sure with horses. The vet has to be involved, the trainers involved, staff that are different that would be involved too. So it's definitely teamwork. Teamwork has to be working for you to have the.
Mm-hmm. Have you experienced any pushback from any of the horses team members?
You
Yeah.
know, I sometimes
Mm-hmm.
it's hard
Mm-hmm.
because the equine industry is interesting. A lot of things that are really mainstream are kind of old school.
Mm-hmm.
Um, and we've always done it this way, right? So why
Right.
would I change it?
Mm-hmm.
And as we learn more, and there's more research coming out and making advances in the medical industry, some of our now recommendations run counter to what people are used to doing.
Mm-hmm.
So if I'm coming in off the street trying to convince them to change this, it can be hard, and you have to be a little delicate sometimes with how you approach that kind of stuff, because people don't like to be told that they're doing something wrong, right?
That's true. That's true.
Or, and their horses are their best friend most of the time, so they're
Mm-hmm.
trying so hard to do everything right. And then if I just come in, guns blazing, telling them they're doing a terrible job,
Uh-huh.
it's not gonna work, right?
Right.
They're gonna tell me to go home and never come back. So you have to be a little bit tactful sometimes, and assume that people are doing the best they can, and just educate on how they can, make little changes to do better.
Mm-hmm.
So
Right.
yeah, the running against the established way of doing things in in anything you do is always a challenge. I
Mm-hmm.
know.
Similar with sports and conditioning, we can,
Sure.
physical therapists would come in and, they would say, this is how we did things. So,
Yep.
right, right.
Yep. Why should I listen
Understand
to
that.
you, right?
Exactly,
Yeah.
exactly.
Yeah.
So, can you describe to us a typical, first day meeting with a horse once an owner or a trainer called on to you and asked you to see their horses?
Sure. So I generally travel to people's barns. Sometimes people come to me, but I usually travel around. So um, I would show up at the barn and, meet the owner, meet
Mm-hmm.
the horse. There's always a little bit of a getting to know you few minutes there where we kind of figure each other out and
Mm-hmm.
make sure I'm not perceived as a threat or anything. And then we talked a little bit about before, how I go through my
Mm-hmm.
treatment plan.
Right.
So I do a lot of educating as I'm going, or I
Mm-hmm.
try to. Sometimes it's hard to multitask, but
Mm-hmm.
I I try to, as I'm going through, talk to the owner about what I'm seeing, and if there are things I know are going to be a tough change to make, I'll kind of start, introducing that idea early on and try
Mm-hmm.
to, drop little tidbits so that
Hints.
they can find their way to the answer themselves, hopefully.
Mm-hmm.
And then, there's go through the assessment, and then at the end there's always a time where we kind of sit and talk and really go into the education, because
Mm-hmm.
like I said earlier, where I can't just tell the horse to go do their home exercise program.
Right.
um, there really has to be a really solid education there, because if I don't get the owner bought in on doing these exercises regularly, because they can't have me out most of the time,
Mm-hmm.
you know 3 times a week. That's just is not really realistic for most people financially or with their schedules.
Mm-hmm.
So I've really got to do a good job on the first day of making sure they know what to do, that they feel comfortable doing
Mm-hmm.
those exercises on their own, and that they're actually going to do it, because there's nothing worse than going to see somebody and they don't implement anything you said, and then they go tell somebody, oh, I had her out and it didn't help, right?
Mm-hmm.
Because
Right.
it no, I there's only so much I can do on one
One
visit.
session. Right.
As I'm good, but I'm not a miracle worker. So um, that getting that buy-in to really get them going on exercises, because I mean, really, that's the foundation of what we can do.
Mm-hmm.
Getting a lifestyle changes in place, and getting um, the movement changes in place is how we make, our manual therapy changes last.
Mm-hmm.
If you just have me come out and massage your horse once a month forever, what's the point of that? So um, the
Right.
education piece at the end, I think, is maybe the most important thing that I do.
Mm-hmm.
And I spend a lot of time on it.
Right. So you also like ask them what the schedule of the horse is throughout the day,
Yeah,
so you have an
sure.
idea.
And
That's nice.
I try to ask about the horse's nutrition, because
Mm-hmm.
what they're eating really matters and can vary widely depending on, what school of thought the owner subscribes to.
Mm-hmm.
So their diet, are they in a stall or are they turned out? Are they
Mm-hmm.
turned out on a big pasture, or are they in, a 40 by 40 square all
Mm-hmm.
day? So that can make a big difference. Um, are they with friends or are they turned out by themselves? All that kind of,
Oh.
yeah, when I'm saying like lifestyle stuff, that's kind of what I
Uh-huh.
mean. What does their day-to-day life look like, and how
Right.
closely does it mimic what a horse, evolved to live like?
Mm-hmm.
So the more we can mimic natural kind of herd life and getting plenty of movement, horses were evolved to move, you know, 15, 20 miles a day back and forth to food and water. And most of our domestic horses stand around like all day long. So
Right.
just like you or I sitting at a computer or a desk all day would make us stiff and weak and
Mm-hmm.
have postural problems, it does the same thing to horses.
Mm-hmm.
So sometimes just changing, how much activity the horse gets can make a really huge difference.
Mm-hmm. Do horses like play like dogs
They
do?
do.
Oh, they do. Okay.
So not as much as dogs, not as much. They tend to be, energy conservers. They have to
Mm-hmm.
be ready, right, to run away at a moment's notice if there's, a predator coming. So they're not as rambunctious as dogs, but it's little spurts throughout the day. You'll
Mm-hmm.
see them get all riled up and chase each other around or play fight or something.
Mm-hmm.
They definitely do, which is part of the reason why some people will put them in an individual paddock, right,
Uh-huh.
without friends, because they're worried they might get hurt or hurt the other horse. So it's a
Mm-hmm.
trade-off there, but I
Right.
tend to prioritize the letting them be with their friends.
That's nice. That's
Mental
nice.
health, right?
Right. So I was about to ask, like, do they get stressed? Do they have to be
Yeah,
happy?
yeah, totally. Yeah.
uh,
Mental health is important for
right,
sure.
for everyone, even
For
for horses.
everybody.
Uh,
Yeah.
so, for someone who wants to get into equine physical therapy,
Sure.
aside from loving horses and knowing more, knowing
Right.
about horses,
Yeah.
what do they need? What qualities do they need to have?
Okay. So I think that they need to be willing to kind of blaze a trail right now,
Mm-hmm.
because there's so few of us. So
Mm-hmm.
it's kind of tough because I have, two or three people I can look to as mentors that are doing this already. But there's not a huge community of support out there like there are for, orthopedic PTs or neuro PTs.
Mm-hmm.
There's a million Facebook groups out there for us to kind of network with. But with equine PT, it sometimes feels like you're going it alone a little bit. So being prepared for that and being willing to just keep going, knowing that what you're doing is helping, is really important. You've got to be good with horses and you've got to be good with people, because if you're just good with horses, like I said before, nothing's going to happen because you have to get the owners and the trainers and the
Mm-hmm.
vets and everybody else who's on that horse's team, to understand and work with them and be a team member with them. So that's super important. I think it would be easy to be like, oh, I don't want to work with people, I want to work with animals, so I'll go into to equine or canine PT. But it
Uh-huh.
doesn't really work like that. You still have people involved.
That's right.
So the interpersonal skills are are important.
Mm-hmm.
And you have to be ready to work outside in all different conditions too, because maybe there's a barn, maybe there's no shade that day.
Mm-hmm.
There you might have an arena with a roof, or you might just be out in the field. So
Mm-hmm.
um
Wow.
that it's I think it's wonderful. I'd love to be outside all the time.
Mm-hmm.
But some people might not want that. So yeah, that
But
would
I,
be an important quality.
but I'm thinking that if you like horses, then
Hmm.
it might be easier for you to be an outdoorsy
Oh,
person
sure.
because
Right.
if you
Right.
already
Yeah.
like horses.
Yeah. Yeah.
Oh, nice. Wow. Well, I learned a lot from our conversation, and I'm really, if only I know how I know more about horses, I could go into that, but I don't think so.
You asked really good questions, and I don't know how many of your listeners are going to even know that much about horses. So I we went pretty in depth. I think it was
Right,
good.
we did.
Uh-huh.
But if only I was I got into that because my friend, I think I've told you this,
Hmm.
that my
Yeah.
she has friends from like a polo club in the Philippines, and he was really looking into getting into equine physical therapy. I was like,
Yeah.
really? There's physical therapy for what are you gonna do with that? And seeing your videos and hearing your stories and your how you treat patients, I'm like, this is very interesting.
Hmm.
I wish I know how to ride a horse or understand a horse. I could go into this.
Right.
Right.
Yeah. Yeah. It's awesome.
uh, it
And
sounds
that's the
fun.
thing. Yeah, it's what I love about being a physical therapist too, right? There's so many different things that we can do,
Hmm.
and so many different avenues you could pursue with the same degree. So it's such a cool career. It really is.
Right. And you see the horses, you see the riders, you
Mm-hmm.
also provide hippotherapy, all about
Yeah.
horses. You
Yeah.
know, that's so nice.
Yep. Yeah. Yeah.
That's
Even just with the horses, you can do so many different things. You can work
hmm
with kids, you can work with riders only, you could work with horses only. I mean, you could make it what you wanted for
yeah.
sure.
And if you want to focus on horses, you can you have uh racing horses, you have like
Yeah.
show
Yeah.
horses, you
Yeah.
have
Yeah.
there's a
Yep.
lot of horses
You
that you
could
can
you
see.
could niche down even more. You could
Hmm.
really, yeah, yeah,
That's
for
true.
sure.
It's a niche, but you can go to niche, other niche in the niche.
Yeah,
So
exactly.
wow.
Yeah, yeah.
All right. So yeah. Thank you again for your time. I have one last question for you.
Sure.
Um, this the podcast is entitled or named PT Meal. It's a
Mm-hmm.
complete meal of like information, inspiration for other physical therapists. So my question for you is, what are the three ingredients that you find true? It may be a belief, a principle, a virtue that is essential in your life. Or what are the
Okay.
three ingredients that make up Barbara Parks?
Okay. That's a good question. I like that. Okay. Um, the first one I think I'm gonna say is advocacy. So
Mm-hmm.
being an advocate for those um who can't speak up, or whose voices are, muffled more than our own. So horses are a good example of that, right? They don't have a voice like we do. So looking out for them. Kids are a similar thing. So I think being an advocate is really important to me, especially as a therapist and, in life in general. Um, the second thing I'm going to say is kind of like compassion and empathy,
Mm-hmm.
trying to see where people are coming from and come at them without judgment, open mind with things. And then the third thing I'll say, I think, is just being a lifelong learner,
Right.
always looking for better ways to do things, not getting stuck in something just because that's the way I did it before. Um, and just putting myself out there and learning as much as I can about different things to make
Mm-hmm.
myself a better person and a better therapist.
Mm-hmm. All right. That's it. Is
That's
that
it.
it? Yeah,
Uh-huh.
I like your answers because all of your answers is geared towards others, advocating for others, for those who can't advocate for
Mm-hmm.
themselves, compassion and empathy for others, and being a lifelong learner to be able to serve better those people that you advocate for. I like those answers.
Thank you.
Nice.
Yeah, that's maybe my problem is I need to focus more on myself sometimes.
Mhm.
I'm good at focusing on other people.
But
But
but those
I think
qualities
that's
are
okay.
important as physical
I think
therapists.
so. I think
Mhm.
so. Yeah,
All right.
definitely.
So before I let you go, if they wanna know more about you, social media, I mentioned you have a YouTube channel.
Mm-hmm. Yeah.
Where can they
So
reach you?
on social media, I'm on Instagram and Facebook and YouTube, all as the Horse PT. So that should be easy to find. And then I have a website. The Horse PT was taken, so I'm drbarbaraparks.com is my website.
Mhm.
So those are probably the best ways. And if people want to email me, my email address is thehorsept@gmail.com. So any of those ways, if you have questions or want to talk more about this, I love talking about it. So
Mhm.
uh, feel free to
Uh,
reach out.
all right, thank you. And I'm gonna put that indicate that in the show notes as well for people to see.
Perfect.
All right.
Perfect.
Again, thank you, Barbara, for the
Yes.
conversation.
Thank you so much for having me. This was fun.